This conference will now be recorded.
Greetings, everyone again. My name is Siziwe Ngwabe. I am the operations lead for Africa Evidence Network. I will be chairing the webinar today, and I would like to take this opportunity to welcome everyone to our 10th webinar titled Replicable Strategies for Institutionalizing Evidence Use Stories from Africa. This is a panel discussion that will be led by renowned speakers, Ms. Harsha Dayal and Ms. Justina Onumah, and the session will be facilitated by Ms. Jennifer Opare Kumi. Just to give you a bit of background around this webinar. This webinar is one of the events that are building up to Evidence 2020 online. It falls under Workstream 1, Advancing the Art and Science of Evidence Use in Africa. This particular work stream aims to advance the knowledge and understanding of how to support EIDM in Africa. And we have two objectives that we aim to achieve with this webinar today. We want to hear stories of success or failure in explaining the institutionalization of evidence use in organizations. And then the second objective is to hear about some of the replicable processes on strategies for increasing use of evidence for decision-making in Africa. So this is really something that we're working towards to the conference to make sure that we have a successful conference. And I think for us to be able to manage this webinar very well, to ensure that everyone gets an opportunity to hear what the panelists will be discussing and also be part of the discussions as they go on. I would like you to keep, we'd like to keep the technical processes very simple, and will not be using webcams for this particular session because we are recording the session to make sure that we can share with you at the end of the webinar. And also, I would like you to mute your microphones, and then we'll unmute you when you are supposed to talk and share your inputs for the webinar. And also, please, as the webinar is continuing, please use the chat box to pose your questions or continue the discussions as they go on during the webinar. The panelists and the presenters will collect all the questions and they'll be submitted during the session. So some of your questions, we'll get the opportunity to answer them during the webinar. If some of the questions we run out of time, we're unable to answer them, we'll answer them via email to make sure that you get what you needed out of the webinar. Please raise your hand by writing hands up in the chat box for questions, and we'll unmute you during the Q&A session that is coming later during the webinar. As I've alluded earlier, in case we did not get to answer some of your questions during the live sessions, the panelists will get back to you later via the email. So we make sure that we cater for everyone to make sure that you get answers to your questions. And then just to say that this webinar is hosted by Africa Evidence Network. The AEN is a Pan-African community of more than 3,000 individuals across the continent and across sectors who are interested in the use of evidence. And together, we're trying to contribute to the end of poverty and inequality in the continent. And also, we want to ensure that we increase the use of evidence in decision-making in the continent. As the SAEN, we have 4 ways of working. We ensure that we inform our members, we ensure that we find different ways to connect with our members, and also find different ways to learn and also advocate for evidence use using different mediums that are accessible to the AEN to make sure that we are able to contribute to the increased use of evidence in the continent. And here are some of the details. You can get in touch with the Africa Evidence Network in those contact details that are shared below on the slide. To move ahead with the webinar, I'll hand over to our facilitator, Ms. Jennifer Opare-Kumi, to continue with the panel discussion with our panelists. Over to you, Ms. Jennifer.
Thank you so much, Siziwe. It is really a pleasure to be facilitating today's webinar, and I'd like to begin by introducing our esteemed speakers. Our first speaker is Ms. Harsha Dayal, who works as the Director of Research in the Department of Planning, Monitoring and Evaluation within the Presidency of South Africa since 2012. Research experience in poverty, public health, gender and disability studies gained during her employment at the Human Sciences Research Council from 2007 to 2014 has provided her with the necessary skills and experience in bridging researchers and policymakers towards critical national priorities grounded in the social sciences. She is championing evidence synthesis as a methodology for building public sector capacity, and has facilitated evidence use of research and is developing a responsive knowledge brokering service to meet the demand of quality evidence by decision makers. She strives towards bringing together the two worlds of research and policy in transforming society and pursuing developmental objectives. You're very welcome, Ms. Harsha Dayal. Thank you for joining us. Our second speaker is Dr. Justina Onumah. She is a senior research scientist at the Science and Technology Policy Research Institute of the CSIR Ghana, an institute mandated to popularize science, technology, and innovation. Her research interest is in the areas of innovation, poverty, research policy industry linkages, technology transfer, and food security. She's been involved in a number of research projects in these areas with journal articles and other publications to her credit. Aside her strong scientific skills, Justina is a great organizer and facilitator of public engagement events such as policy dialogues and conferences. Over the years, she has championed science and evidence use through her policy, stakeholder, and media engagement activities. In 2016, she led a team and won the EU-AU Evidence and Policy Events Marketplace of Ideas at the European Joint Research Centre in Ispra, Italy. You're very welcome, Dr. Justina Onumah. Thank you for joining us. So to start, the power of narrative stories is great, and we want to extract lessons from stories to help advance our understanding of evidence use in Africa. So I'm going to ask each of our speakers today to tell us their story of success, or even quote-unquote failure, that speaks to us on their experiences of institutionalizing the use of evidence in their organizations. So we want to know a story that seeks to get at a specific example, and if they can tell us the story that demonstrated their intended impact. So please tell us your story of success or failure that speaks to your experience of institutionalizing the use of evidence in your organizations. So we'll start with our first speaker, Ms. Harsha Dayal. Thank you so much.
Thank you, Chair, and thank you everybody for this opportunity. I hope you can hear me. We are experiencing load shedding as we speak, so I hope we won't be disrupted. But I guess this is technology at its best as well. I really welcome the story or the narrative side of it, and not just a presentation, because it almost seems like this has been a journey over the past. I'm think from the time I was actually a public health official in government at the forefront of the health sector. So the big word for me is really institutionalizing and all its synonyms that comes with it. Institutionalizing, institutionalization, institutions, and I think over the years, it's not something that a textbook can help explain anything in practice. And so over the years, for me, the experience had come with actually getting into these kind of situations that made sense in some ways, that didn't make sense at all in some other ways. And for me, I want to also just ask the audience to reflect on what institutionalizing actually means to everybody. And I think that for me was the starting point. And already way back in the early 90s and early 2000s, I came across this word, and it was in the context of patients and healthcare services. But over the years, it became quite from an abstract to a more practical situation. So there's good stories to tell in the sense that, you know, if you start breaking down the understanding of institutionalizing, being the big understanding is that what do people understand in terms of the rules of the game? What game are we playing? And in this instance, it's about evidence use. And how do we all understand evidence use? Is it a linear process? Is it a collaborative process? What is our starting point? And if the rules of the game shifts and changes, this is how it gets expressed in how we practice it over a period of time. And is it left to us as individuals to form relationships that I see you think like me and we now work together, so that's why we can understand each other? But the difficulty comes in when you work in organizations that do not really abide by the rules of evidence use, and you have to create those rules. So this has been the journey for me. And yes, there were times when there was clear failures, and the failures came when, you know, you build a whole project around the full value chain of evidence use, but others are not on board. And others, being the people we depend on, are not really on board with us. So you run away with the project in terms of fulfilling its deadlines, its timeframes, its commitments, and you find that you've left some people behind because they didn't really understand the rules. So yes, there was clear failures, but you know, failures only become failures when you don't learn from them. And I would want to think that we've really learned from them, and we have put a lot of things into place. So I hope that we can share a lot more from just this webinar, from that sheer narrative part of it in the storytelling. Thank you. Over to you, Chair.
Yes, thank you so much, Ms. Dayal. Allow me to just probe and ask you a question to further elaborate. I appreciate what you said about failure only becoming failure if we don't learn from it. And I think this resonates with many of us in the room today. But I wondered maybe if you wouldn't mind telling us one specific story, maybe, or success or failure, where you really felt that you were able to advocate for this institutionalization. If we could get a little bit more on that, that would be appreciated. So I'm going to hand that back over to you just to tell us a short story again, and then we'll move to Dr. Justina.
Okay, thank you. I'm going to obviously choose a success story because I think maybe we can talk about some of the failures in a way of unlearning and learning again. But in terms of a success story, I think that very early in a process of introducing evidence use, it comes with the belief that this is an approach that's going to be useful, not just for the task at hand, and the task at hand is, to inform policy and decision making using evidence. So when you have the task that's very clear, the success was really in bringing out or taking an opportunity of a moment in a policy space. And I think for me, that always brought out the success of the human settlements work that we started with. And the human settlements work in the area of housing to human settlements transition in South Africa, I can say that we were at the right place at the right time, trying to meet evidence needs by decision makers at the point when they were ready to listen. So we were there as a team to be able to bring in evidence methodology that brought together for us how and why we're saying that scientific evidence alone was not enough. And that got the ball rolling in quite a lot of discussions. So we got very much involved in the process of just bringing through the evidence, finding the kind of, and I'm talking about the processes now in terms of the way we brought the understanding through, that because it was an opportune moment, you couldn't go back into a safe or comfortable mode of let me first go into science and research processes. It was really dealing with management structures very efficiently, being responsive at the time of the need. And we delivered a very, how can I say, a more innovative and creative approach that we at ourselves didn't know the value of it at the time. And over the years, we've just kept on building on it. So I would say that the biggest success was taking an opportunity moment in a policy space, working with our networks that we had really and built relationships over the years. When we did have the time to experiment with methodologies, we had built quite strong relationships, and obviously Africa Center for Evidence is one of them, but an international movement as well. And because of those relationships that were built, we could hit the ground running, so to say. And when we hit the ground running, it was being really agile and vigilant in what was needed, being responsive and providing very clear scientific processes by which we could argue what evidence was used, why it was used, where it was sourced, and how it could influence the decision-making processes. Whether they were used in ultimate places, it was the test to come over a period of time, and we can see in the last 2-3 years how it started to shape the human settlements agenda. So that clearly for me and team in DPME was the success moment.
Thank you so much, Ms. Dayal, for sharing that story on the human settlements work and really just making use of your networks and policy space. Thank you for sharing that story. I'm going to now pose the same question to Dr. Justina to tell us one of your many stories of either success or failure and how you managed to institutionalize the use of evidence use. So over to you, Dr. Justina.
Thank you very much, Jennifer. First of all, I'd like to say thank you to the organizers for inviting me to speak on this. It's a topic that I built a passion for it. I wasn't trained for it, but I kind of built a passion for it along the line when I began to work with the institute that I work with. We are the Policy Research Institute under the Council for Scientific and Industrial Research. So I must say that we are the only kind of socio-economic or social science institute under the Council for Scientific and Industrial Research of Ghana. And our main mission is to conduct research to provide knowledge-based information that contributes to the formulation or implementation of policies that are based on STI. So that is our vision. And this we do through monitoring and assessing S&T policies in all sectors. We do a bit of assimilation and popularization of S&T. We also facilitate and commercialize technology transfer amongst a few activities that we do. So when we talk about institutionalization of evidence-based policy making, for us at the Institute, if you went through my my statement of mission and then the activities that we do, it's more or less like we've already been mandated to do that. So for us, it wasn't like we needed to learn something to influence evidence-based policy-making process. That is our mission. That is what we're supposed to do as an institute. And what we do mostly is to collate the research findings of the other natural science institutes under the council. The council has about 13 research institutes. And as I said earlier, we are the only ones that conduct policy research, so purely socioeconomic research. So for us, the problem has always been, as you can see on the screen, we have a lot of evidence, as in we have a lot of research outputs, if I can put it that way. But when it comes to influencing the policy-making process, you realize that the policymaker is always still searching for something else. If you look at the slide, there is the healthcare policy, there is conclusive data, there's an evaluation result that is there sitting somewhere in the research institution, or probably it's even at the desk of the policy makers. But the policy maker or the decision maker will still want to find evidence somewhere. So the question we ask ourselves is that, why do we seem to be looking for solutions when there are so many around us? Is it because the evidence we provide or the research outputs we provide are not credible or sufficient enough to influence the policy-making process? Or is it because we haven't engaged enough? And that was something, the engagement aspect was something that I think the Institute wasn't really doing at some time or some years, but the Institute is more than 30 years. I joined the Institute about 8 years ago. So what happened was the success story I would share came from a project that we undertook. That is the development research uptake in sub-Saharan Africa. It was a regional-wide project that was funded by the UK government. And basically what the research sought to do was to build capacities and increase awareness of evidence use. So that was where we started from. And that was actually where my interest in evidence-informed policy-making processes are. So if you talk about institutionalization, you realize that for the Research Institute, what do we gain in influencing policy? Our productivity, our promotion, everything is based on how many journal articles you're able to produce. There seems to be no reward system or incentive mechanism that says that, okay, if you are able to push for a policy process, probably you might gain twice a point than even publishing a paper. In that way, we'll realize that our attention will not be so much focused on writing papers, as the saying goes, publish or perish. But then our main mandate or our main focus will also be to impact in the area of policy that we want to influence. So if we want to institutionalize evidence-based policy-making processes, especially from the supply side, there should be some kind of reward system to the various actors or the various researchers that are within the institute. And then also we probably need to have some dedicated unit that could facilitate this. And for us at Step 3, it's not that we have a specific dedicated unit. It's like our core mandate is research, but aside research, it's at the back of your mind that you need to influence policy. So what you actually do is after every research or project that you undertake, you need to go through the process of engagement. So we usually do lots of public engagement, either the stakeholders, we engage them on the findings, they kind of validate the findings, and then we develop policy briefs out of all the research findings that we find. So usually for these policy briefs, and I must say that one other way of influencing these strategies is for us to have a long-term partnerships and affiliations to the various ministries. And for us at the CSIR, we are affiliated with the Ministry of Environment, Science, Technology and Innovation. And because of the nature of our work, we also work very closely with the Ministry of Trade and Industry, and then also the Ministry of Food and Agriculture. So for these, especially these, we work with other ministries, but these three ministries are the kind of the core ministries that kind of hold our work. So because of that long-term partnership, probably sometimes when they need to commission a research, they usually rely on us. So when it becomes a demand-driven need, you realize that they accept it more. So going back to the DRASA program, what DRASA sought to do was building capacity. It had like 3 main streams. So we needed to build capacities of policymakers in the use of evidence. And how did we do this? So what we did was we wanted the ministry or the policymaking institution to own the process. So for every activity that we did, we needed to engage them, even to ask them which kind of issues that they want evidence on. So for the capacity building, we did a need assessment survey. And this needs assessment survey kind of outlined the areas that policymakers would want training on. And 3 key areas came up. One was a process, they wanted to learn how to influence the policymaking process with research. So when we give them the research output, how do they influence the policymaking process? That was one. And then also for assessing research, so databases and all that research sources. And then key, they also wanted to learn on research methodology, both qualitative and quantitative. So the capacity needs assessment brought up these 3 core areas that the ministry or the policymakers, mostly the middle level policymakers and the junior level policymakers sought that they wanted training on. So we also worked with the university. So the university developed modules on these and then trained them within a number of period. And I must say that it was really successful. So you could see that people, the policymakers, especially the middle level and then the junior level staff, were kind of now interested and then kind of building their interest in evidence-informed policy and even the need for research. Sometimes somebody will even ask you, even CSIR, what at all are you doing? So people are not really seeing our impact because usually we say science don't talk. Scientists don't usually make noise. So this project actually kind of pushed us into the limelight. So aside the capacity building, we also did policy symposia. And these policy symposia, we organized about 15 of them in a period of 2 years. What the policy symposia sought to do was whatever current issue that the ministry, the 3 ministries would wanted research evidence on, we just went to them, we drew our program together with them, then we will ask them. So we have a series of 5 policy symposia with your ministry. What issues would you want to be discussed in the first symposia? So they will jaw and then call us back and then give us a topic. So we don't push any research topic on them. So they give us a topic. So our only responsibility is to find a research person or an academia who has strong knowledge in that area to come and lead the policy dialogue process or the policy symposia. And out of the policy symposia, we develop brief, like policy brief, that usually after the policy symposia, we take it back to the ministry so that it becomes a bit concise, not just writing a workshop report or writing a long essay. So it's a brief, like maximum 2 pages of whatever transpired and then the conclusions that we all arrived during the policy symposia. So that was it. And the one main success of one of the policy symposia that we organized in 2014, the government through the Ministry of Food and Agriculture implemented a policy called the Fertilizer Subsidy Program. And there was a lot of debate on it because it was draining the government's purse. So in 2014, the program was halted. There was no longer in fact, so government was still thinking around it. So one of the policy symposia topics that the ministry contacted us to do was to find the impact on the fertilizer subsidy program. So we invited academics who have worked on that policy in terms of finding its linkages with productivity and law in Ghana's agriculture. And after that symposium in 2015, the policy returned in 2016. I always tell people that we don't want to take much credit, like total credit for the policy returning, but at least we could say that because it came from the ministry, came from high-level staff, at the ministry. Even we had the deputy minister really championing our symposia. So we believe that in a way it also affected the policy process. And the last activity under the program was also embedment of policy fellows. The policy fellows were more like researchers or academia, and then they were supposed to be embedded within the ministry for a period of 6 months full-time or 1 year part-time. And the selection of these policy fellows was also done in collaboration with the ministry. So the panel of experts who were interviewing had one of the policy makers in each of the ministry that we wanted to place them, also part of the panel of discussion for them. So when we selected these policy fellows, it wasn't that research just imposed somebody in academia. I remember one of the ministries when we were trying to engage them on this placement of policy fellows, they were a bit reluctant. And then one passed a comment like, don't bring somebody who will come here and pretend like they know more than we do. So in this case, when we opened up the process, okay, we call for applications, people applied, we shortlisted. Now come in and then assess whoever that you think that will be able to work with you. So the choice of every policy fellow within the particular ministry was done together with the policymakers. So one key thing that really worked for us was getting the buy-in of the policymakers. Without it, the project would have failed, because just like the other ministry that I talked about, they were more or less like, okay, we are also academicians because we had PhD holders within the ministry and all that. So bringing a professor or a PhD holder to come and be like a policy fellow, kind of superimposing the person on us, thinking that we don't know anything. That is sometimes misalignment. And then so trying to more or less like involve them and engage them for them to own the process, it's a huge success. And for this policy fellows embedment, it's really impacted on evidence use because they were closer to them, they work with them. So this time they will commission the fellows to kind of do some policy reviews or whatever they thought they would want research to do. It was now very close to them. It was now very easy for them to get someone who will be able to handle that particular aspect for them. So those were our successes. And after that particular program, you realize that now staff are beginning to have more interest in trying to influence policy. As I talk now, there's one of our staff who is really pushing a policy on aflatoxins because her interest is in food and nutrition security. So for her research that her project that she's been handling, she's been able to push it almost at cabinet, and that's a huge success for her, for instance. So now it's like it has created more awareness on what our core mandates is supposed to be. And we do a lot of media engagement as well. The print and
Dr. Justina.
Media. So you find researchers on their projects and stakeholder meeting, they always want to brief the media. So they will do print media publication. Some of them also go on radio, go on TV to kind of popularize, just more or less to make people know that we are there and this is our mission. So the successes are that, and then the key thing is making the receiver own it. Because if we don't make them own it, it will be difficult for them to accept. And also, we that we are supplying the evidence, we need to know that there's some level of capacity we have to build. If we build the capacity and interest together with making the receiver, who is the policy maker, also know that we are there and we are there for them, not that you want to impose a particular evidence on them. It really goes a long way to kind of establish a successful evidence-informed policy-making process. So that's
Thank you, Dr. Justina.
And probably I can talk more if you may give me a follow-up question. But for now,
yes,
that was a very big breakthrough for us.
Thank you so much.
Yeah, thank you.
Thank you for sharing that. It was really enlightening to hear about your demands-driven approach, and especially what you shared about the policy fellows and embedding them. That was great to hear that story. But I wanted to move on to the second question because I realized actually that you were picking a lot of elements of what we're wanting to also get into. So I'll give you another opportunity to speak more to the strategies and elements of decision making there. So I'll first go back to Ms. Dayal and ask if you can talk us through what you consider the key elements or strategies for increasing use of evidence for decision making. And of course, I am aware that some of these have come out through your story, but if you could draw them out for us, we would really appreciate that. So over to you, Ms. Dayal.
Thank you. Thank you a lot. This is an interesting question because the case of replicability brings in a bit of a scientific rigor to it as well. And I think I wouldn't have been confident in talking about replicability if we didn't try and test the same approach that I talked about success to other areas. So just to say that, you know, we worked through a whole process of looking at identifying needs and being, obviously we weren't lucky like the first time to be in the right place at the right time, but to have found that what we had success in could be replicated in itself. So I think the strategies was very much to keep an eye out for, I look at it in two separate processes. So eye out for formal processes within your organization. And what I mean by formal processes is any organization exists. And I think my colleague had been speaking about mandates, and people all talk, and that's quite a lot of government lingo about your mandate. But I think outside of government, we talk about you know, the reason that you exist, even if you're an NGO. So formal processes, and for me, the kind of activities that happen within your organization, which are formal and internal to your organization, are like the business intelligence. So basically, what do you exist for? In our case, we are there for planning, monitoring, and evaluation. But there's a certain structures within there. Keep an eye on the management processes. Who are the real champions that will be able to understand without keep explanations going on about why evidence is important? But I think the biggest one for me is the lack of attention on information management systems. And I think I'm using information management system because it's a core process that any organization should have. And without that, these are the kind of strategies that sometimes are so silent, so not explicit, that it actually becomes the reason for failure in the long term. And the other aspect of a formalized situation is this: we constantly hear about relationship building in the networks, because the opportunities are also beyond your organization. And here comes the issue of institutionalizing, because if we understand evidence use as a value chain, that those that are producing are not only just the scientists, but those that are producing are also the ones that are at the forefront of service delivery. But the kind of dependency on evidence is across the board. And it can't then just be about relationships, but it's supposed to be about formal collaborative partnerships that becomes the vehicles through which we want to deliver on the task of evidence use. But I think in a context, and I'm talking about the broader environment, in a context where it's ever changing, there's, in terms of government, there's always structures that are changing. So we find that now there's new structures, or two departments have been amalgamated or split up, whatever the reason. My biggest strategy that I have put over the years was follow the function. Follow the roles and the functions in the midst of change, because sometimes functions will shift and new actors come in the picture, but there's just new people, but doesn't mean that the function has died off in a way. But it's the function. So that's where the relationship building becomes so important. Now I'm going to just say that in terms of the fact that when you keep a relevance in a dynamic context, there's a certain thread that must always be there. And that's where the replicability for me comes in, is that when you develop a methodology and an approach and you trial and test it in various sectors, in various environments, and when it's not just relevant in your context, which is the South African context. So we have been sharing a lot of our approaches in other contexts, and there's a lot of other partners that find value in the same approach. So the replicability comes from developing, strengthening, and really putting into practice a methodology that works. And this is for me the kind of mapping and narrative, that's policy narrative frameworks that we have been developing, that by far has not, there was no failures according to that. It's just brings a lot of the stakeholders together, a lot of the tasks, and institutionalizing becomes just in practice the more doable part, because it's bringing in, it's aligning people and the tasks and the processes are all aligned towards meeting, I won't say meeting the same goals, but being able to help the contexts that are different in places, but the methodology is the one that keeps people. I think that the fact that we are talking about the kind of strategies that assist in decision making, we do accept that it will differ and adaptability may be needed, but it really becomes a core strand through which we know that we still keep our scientific basis and tracing back where evidence had come from. So for me, that is the more important one that I think had been a trial and tested approach to evidence use over the years, which really has brought out the strengths in the work that we do. Thank you. Over
Thank
to you,
you.
Chair.
Thank you so much, Ms. Dayal. Actually, something really stood out from what you were saying, and you said follow the roles and the functions. And I wondered if you could, that is just such a vivid image and it's so descriptive, if you could speak to some of the challenges that you would encounter in doing exactly what you've just described.
Thanks. I was wondering whether that someone's going to pick up on that one. You know, when we have every 5 years a new administration, and this is very typical of working in government. And I think that a lot of my colleagues will understand what I'm saying, and possibly also from the other countries, that when you have that, they say there isn't political will, or there isn't the kind of continuation from one administration to another when an intervention is introduced. So this becomes the dynamic, and I would say the more negative context within which we do work. So maybe negativity is a strong word, but it's the kind of survival that we need to work in a changing context for all the time. So when you find that structures change, and this is very much an institutional context challenge, that when structures change, it follows that processes will change. But sometimes we lose the fact that, you know, the function of planning, the function of evaluation, the function of monitoring, that is in our department per se, but the function of coverage of healthcare, the function of being able to have every child attend school, those kind of functions never shift, never change. And the roles of provider roles and regulatory roles, and those are the functions and roles I'm talking about, they will never shift. But in a context of changing environments, you find you spend all this energy and time to capacitate an individual, and in the next 2 years they have changed over. So it becomes a frustrating situation, and I think this is where the challenge comes in, that capacity building programs have forever had to adjust and be resilient towards. But when you're talking about organizational level work, organizations are the delivery for service delivery and change. I think the functions are the ones that I have always tracked and have always maintained the kind of aligned methodology to the function, and then the people who are involved will have to fall in. So that for me is the secret to how I've always found. Thank you.
Thank you. Thank you so much. That was great. Dr. Justina, please do share with us. We want to hear about some of the replicable processes on strategies for increasing use of evidence. And if you can talk us through some of the elements that, the strategies that we can use, that would be great. So over to you.
Thank you very much, facilitator. So the first thing that comes to mind for me is the credibility of our evidence. If we pay so much attention to the credibility of our evidence, especially to the third party, not like an internal validity sort of, but like an external validity. So how do we make our research credible such that if we want to influence the policy making process, it's easily acceptable? We need to be transparent in the generation of that particular evidence. Yes, there are some projects or there are some research that probably the goal is not to influence policy process. But if you think that you are organizing or you are undertaking a project, the goal is to influence the policy making process, you need to make the process as transparent as possible through public engagement. So whoever is going to receive the evidence to influence any process or decision making has to be involved. And not that they should be involved in the conduct of the research, but something like even for the popularization of the findings, make them kind of feel a bit important to the process that, okay, this is what I found. Can you validate this finding for me? When you do that and you produce your policy briefs and you take it to them, they feel part of the process because they have validated those findings for you. And then also for the researcher, we need to assess the political environment. That is one thing I've learned during that particular program in 2014 that we organized. We realized that the ministry that we were able to make the most impact was a ministry that had a deputy minister who was a researcher before becoming, so the person was an academic before becoming a policymaker. So it was so easy with that particular ministry, because if the top level is kind of pushing the research support, then you could imagine that definitely the middle level and the junior level will respond accordingly. So if we're able to assess the policy environment, then we'll be able to learn how we can maneuver our way through it. So if you realize that, oh, okay, probably there is a staff or there is a top level policy maker or decision maker who I can leverage those support on, you shouldn't be too afraid to take that leap of faith. Because when you do that, it kind of gives you a stronger leverage for you to be able to advance your EBP that you want to influence. So just like I said in the earlier submission, somebody says, do not bring me somebody who want to pretend like they know more than me. So already you should understand the kind of perception or the kind of framework that the staff or the policymakers in that particular ministry are using. They think that they have enough capacity because they are PhD holders also among them. They've also conducted research. So in such a ministry, your approach should be different from another ministry, the way you approach it. So now the person really wants to feel that, okay, I also know the process. So don't bring me somebody who come and impose on me. Then you need to change your strategy. So you make them more involved. So understanding the political environment of the evidence-based policy-making processes that you want to go through is really, really important. And it worked for us because we knew how to deal with each of the ministries separately. You had somebody who wasn't necessarily a researcher or probably an academic, but they were very receptive. So if you get a very receptive policy environment, somebody who is ready and very enthusiastic to champion the process, and especially if you're able to get a middle or top level decision maker, it kind of helps push the processes. So studying the political environment is really, really important. And also, how do we churn out our research? I remember during the early processes of engaging the ministries, we met one minister in the education ministry, and then he said, look, somebody came, the person appeared to have a very interesting research output. But look, then he showed us the volume of reading that this person brought to the minister. So he said, look, it's not that it's not interesting, I don't have that time to consume this. So then it tells us that the way we package our findings is really also very important. If we package our findings like as if we are going to present it to an academic person or a research person to kind of digest everything, it wouldn't work. So we should know how to package those findings, make them simple policy briefs, just like here too, or just a highlight. It's easy. These policymakers are busy on their toes because most of them are politicians. They are thinking of the next election. So they are thinking of how to win their constituents. So they do not have that much luxury of time to consume the volume of information that we submit as researchers. So one thing we need to do is to learn how to package our findings, package in such a way that it becomes very easy for them to consume. And the linkages are also very important. We need to establish it. So for our linkages, for instance, so there are times that we second staff from the research institution to the ministry that we are affiliated with, about a year or two, then they come back. So in the end, they are researchers, they go to policy making institutions, they kind of learn the environment, they come back and then integrate into the system again. And we realize that the approach to work, the approach to evidence-based policy making changes entirely. And it helps the relationship between the two. So linkages are also very important. And then the last one I would also say, it's the timing of our evidence. For instance, I spoke about the fertilizer policy subsidy. We couldn't have done a fertilizer policy subsidy symposium now because it will no longer be relevant. So we need, as researchers, to also be smart on the environment, on the economy, what is going on, and what we can easily present that will be timely for the decision maker to say that, oh yes, this particular evidence is really strong and I can use it in the time of need. If we do it either before, if sometimes even doing it prior to the problem is better than doing it post to the problem, because in the end, then they've already found a solution. Your research is no longer relevant. So we need to learn how to time the presentation of our findings. So if you really want to influence the policy making, we need to be in tune with the economy, understand the issues that are going on, and see how best we can also influence the process. Thank you.
Thank you so much. Thank you so much, Doctor. And I'm going to hand over to Likwa for the questions, but you have both given so much for us to discuss. So Likwa, please walk us through the questions.
Thank you very much, Jennifer. It has been an exciting and engaging discussion. And indeed, we do have a couple of questions and comments. We were left with 10 minutes or so. So maybe if maybe our speakers can respond, say in 2 minutes, a question, that would be great. The first question is directed to Ms. Dayal. It reads, would you say the use of evidence has or could drive policy via court rulings where orders are made by means of reference to rights, where the court is persuaded that policy needs to match citizens' rights? Mr. Dayal?
Apologies. Are you going to go through all the questions and then we can answer together, or you're going to go one question at a time?
Oh, so the plan was to actually pose a question to you and you respond. Then the next
Okay.
one I wanted to
Okay.
just yes.
Okay, so this is exactly the kind of institutional structure that we should be able to understand. So definitely, yes, Michael, the use of evidence in terms of court rulings has been demonstrated over the years, where in the way every country is functioning, there's three arms to the state. One is the government, that's the executive arm. The parliamentary is the legislative arm, and then the judiciary is the one that goes into the whole court rulings. So where government has failed and citizens take it up with the Constitutional Court, there has been definite cases over the years that court orders have forced government departments, whether it's national or provincial or even municipalities, to deliver on constitutional imperatives. We've seen it in the health sector, we've seen it in housing, and we've seen it also now in education, and more recently in South Africa, the COVID situation, where the human rights lawyers had actually taken government to court to open up the school nutrition programs when children were going through hunger. So in short, yes, definitely there was many court cases that has persuaded the policy shifts to happen, and the regulations and the implementation that held government accountable. Thank you.
Thank you very much, Mr. Al. The second question is directed to Ms. Justina. It reads, Justina mentioned working with a set of core ministries and developing long-term partnerships. To what extent does trust between suppliers and users of evidence contribute to institutionalization?
Thank you very much, Sizwe. Yes, trust is really important, because if we don't have the trust, it will be even very difficult for you to penetrate through the policy-making arena. So when you build long-term relationships and then you are able to work together for a period of time, then we kind of understand each other. It builds the trust. Without the trust, it will be very difficult. It's not that they don't trust that probably you are providing them with a credible evidence. Probably they don't even trust your capacity to kind of even influence the policy-making process. But when you have that long term, like for us, for instance, we are just affiliated to the Ministry of Environment, Science, Technology, and Innovation. It's a tight affiliation. It doesn't change anything. It's a kind of an administrative affiliation. So with that, it's very easy to kind of work with them. And it's very easy for them to also approach us in a way that if they want any research evidence on anything. And I must say that sometimes when it has to do with any research on STI policy, or if they want to find any, we are the first institution that they contact to be able to commission that research for them. So it's really important. Trust is very, very, very important that we cannot do away with. So how we build our trust systems with the receiver of the evidence is also very crucial. So we need to learn how to navigate through all that system. If we believe that, so for that particular ministry, I cited that they were very reluctant in accepting the policy fellow. You have to negotiate your way through to, if you really want to influence the policy making processes within that particular ministry, then there is this level of extra work you need to do to be able to build on that trust. Otherwise, nothing will work for you. So trust is really important.
Thank you very much. Yes, thank you very much. The second question is directed to both speakers. So maybe if Mr. Al will go first, then Justina, you go second. The question reads, what are the lessons, challenges, and good wins in institutionalizing the use of evidence? I guess the question is asking, you know, the question around institutionalization of evidence. What are the benefits of it? What do we gain by institutionalizing? Thank you.
So I think a lot of what we've said, what I've said over this whole webinar was towards that whole answering that whole question. But I don't think there's an end point in institutionalizing. There isn't a we have arrived at this point now and we are now institutionalized. We have institutionalized evidence. So the point for me that was always a take home message in whatever I was doing was that if you unpack the task of evidence use, and when we understand all the different components, so from who's producing, and is it primary studies, and whose voice is coming forward, and how do we bring all of those contributions to defining the problem of society together, then are those that's the inclusivity that is understood. We often talk about it. We in the health sector, we know that patients' rights matter. We know that parents' situations in education matter. The inclusivity is always there, but we always find difficulty in how that is institutionalized, and that comes back to governance structures. And when we don't have effective governance structures, and what I mean by that is actually creating those kind of structures where these different voices can be expressed. But I'm not talking about consultations, but I'm talking about in a way that representation of different agents are there. So that becomes the challenge. So institutionalizing of the different evidence sources, and I'm actually going to contribute to Kieran's question as well about evaluations and institutionalizing the evidence use there in terms of a policy framework on evaluations. Is really the point I'm trying to make is that if we take a certain sector and a certain policy process in whatever stage it's at, when you see that the evidence you're generating is probably not inclusive, or it's one-sided, or it's biased, there's going to be some form of a contention or conflict management, or conflicts that you have to bring out. And I think this is where the transparency issue comes out. So in a way, institutionalizing for me is not divorced from governance structures. And we always talk about governance structures, that's something out there. But when we have research and evidence generation and sourcing of information and all the processes that we all are very familiar with, because we are so we are always working with evidence, but how do we know that it's inclusive? How do we know that the agencies that we've brought into the process are representing those voices? We don't often know that, and we don't often test it. And only when a report is done and dusted and evidence has to be used do we start to question that process. So I think this is the part that has to become a little bit more explicit, a bit more standardized, a bit more across the board. It doesn't matter which sector we're talking to. It has to be tackled better. Thank you.
Justina, if you want to respond.
Yeah, thank you. I think Harsha has spoken almost all the vital points that the challenges and good wins in institutionalization means to evidence, use of evidence. One last thing I would want to add is that when we do institutionalize evidence use, especially from the supply side of evidence, it builds the capacity of the researchers not to only think about producing journal articles or other impact pathways that they think that they've made contribution to society, but actually influencing the policy making process to make us relevant. I mean, you realize that not in relevance of research to the public, especially for those who don't really understand research. They don't even see our relevance until COVID came, and then you realize that now people are running behind and waiting for data to make informed decisions. The president is waiting for data and science to make informed decisions on what next to do with the control of COVID. Sometimes people talk as if researchers are not even relevant. What at all are we doing? Because they don't see the impact. So when we do institutionalized evidence use, it makes us work harder. It makes us also kind of focus our research. And then because it's evidence use and you deal with engagement, whether the public or the policy makers, it makes you relevant. So it makes science relevant in our everyday decision making, especially to the third party, which is the public and then the policy making processes. Thank you.
Thank you very much. Maybe on that thought again, on your last point, you mentioned something around capacity. There's a related question. It reads, what role does capacity strengthening play in institutionalization, and what types of capacity? Yeah, maybe if you don't mind, just not to just carry on with your last thought, and Harsha and Ms. Dayal will come second. Ms. Dayal, maybe you can respond to the question. The question is, what role does capacity strengthening play in institutionalization, and what types of capacity?
Okay, sure, thanks. So I think if we accept that institutionalization, and before I answer the capacity issue, because we have to understand at what level we are targeting capacity building and strengthening of capacity. So if we take different organizations and the systems, understanding a systems approach to evidence use, then bringing the two together, we realize that when you are on a one-on-one basis with somebody at a micro level, you're talking about meeting somebody's needs and meeting a client-based, so in a client-based or a citizens-based view, it becomes an interdisciplinary level, interprofessionally, that you can see that something like ECD, you're working with health and education and social development, so social workers and school teachers and all of that. So at a very micro level, you talk of capacity building of professionals and policymakers and even the parents and even those that are citizens directly influenced. But when you come to the point of, okay, which organization's function it is, you talk of an agency or an organization that's supposed to have this function being built. But we then have various different programs and projects within an organization, and there's a different level of capacity needed there. And that kind of capacity is organizational strengthening, where I mentioned only one or two, but in terms of the information systems, in terms of how evidence is valued or not, and how the different we talk about IT systems and the information age that's we upon in terms of the fourth industrial revolution, yet the organizational culture is not creative enough or doesn't want to do things in a different way and continues on path dependencies or just deal with institutional memory in a way that they know best. And that's where capacity at an organizational level has to have different strategies. But when we talk of institutional, then you have a provincial government, for example, provincial governments using national policies in various ways, but it's still one sector that we're working with. And there's just so many different ways that even one policy is being implemented, and we see it constantly in implementation failures. So capacity then becomes quite a complicated task for anyone who's building capacity to move outside of individuals and building capacities only of individuals. What is needed to actually strengthen organizations, strengthen the agencies, and strengthen in terms of the broader context within which institutions are built. So I think this is for me quite a challenge. And if I use a critical way of looking at capacity programs, then that's usually what I fall back on. Thank you.
Thank you very much. Ms. Justina, do you want to say something? Okay. We are unfortunately out of time, and I will now hand over to the chair, Siziwe, to wrap up our webinar. And I would just like to thank you all for attending and for contributing. We had lots of questions and comments on the chat box. This was really an exciting engagement. Thank you very much, Ms. Siziwe.
Thank you very much, Likwa. I would like to just take this opportunity to thank all the speakers for a robust discussion that we just had, and they also shared amazing stories that they shared with us. Thank you very much. Thank you to our facilitator. Thank you, Jennifer, a lot for facilitating this robust discussion this afternoon. And also, thank you very much to all our participants. The chat box was really great. People were interacting, asking questions, giving their inputs. That was really thought-provoking. Thank you very much. Thank you to the AEN and the ACE team. And also, most importantly, thank you very much to the working group of Workstream 1, led by Mr. Likwa Ncube. Thank you very much for putting this together and building up to your Workstream to Evidence 2020. Please, everyone, join us virtually for Evidence 2020. It's happening on the 23rd to 25th of September 2020. Please register. There's a link that's attached to this presentation that will be shared with you. And also, we'll share the recording of this event so that you can be able to, in your own time, listen to the discussion that we had. And also, just to say, the AEN, you can register to be a member of the AEN. It's free of charge. Please join us for Evidence 2020. That is also free to register. Thank you very much, everyone, for a thought-provoking webinar. As a chair, I would like then to take this opportunity to adjourn this webinar till we meet again in the next event. Thank you, everyone.
Thank you.
Yeah, thank you for having us this way. I think I lost my connection along the line.
Yeah, I saw, but you did well. It was great. Thank you so much.
Thank you.
Okay, bye.
Bye.
Everyone.